Interface Video presents Fairhope Hospice Today. Brought to you by Fairhope Hospice and Palliative Care, Fairfield Federal Savings and Loan, Fairfield Medical Center, the Fairfield County Board of Developmental Disabilities, Dagger Law, and the Frank E. Smith Funeral Home.
Welcome to Fairhope Hospice Today. I'm Kristin, President and CEO of Fairhope Hospice and Palliative Care, home of the Pickering House. And today we are bringing our show to you live here from the Gorsuch Room at the Pickering House at 282 Sells Road. And I am really excited to introduce you to two of our guests. We have two of our physicians with us today, and I'm going to let them introduce themselves. Thank you so much for being here.
Hi, I'm Dr. Brian Varney. I am the medical director here at Fairhope Hospice. I'm a family practice doctor by training, but basically a geriatrics doctor by trade. I've been with these guys since 2003 on a volunteer basis, and I think since 2006 or 7 as an actual employee. Just really enjoy the work we do here and being able to be part of the journey.
Thank you.
I am Dr. Barbara Singer. I'm a medical director here. I also am family practice, and this is a very relevant part of family care because carrying our patients gently at the end is the difference for how the whole family handles the death and this experience. It's a lovely thing to be a small part of, and I'm proud to be a part of Fairhope.
Thank you. You know, when we think about how long you've been here, Dr. Singer, how long have you been with us? 15
Yes, about 15 years.
Okay.
Yeah.
So we have two seasoned physicians, hospice physicians here. And, you know, I just want to ask you, I know a little bit about, obviously, your start with hospice, but why hospice? What brought you to us specifically, but why hospice?
Mm-hmm. Well, for me, hospice chose me. I did not have any personal experience with hospice until 2012 when my own father passed away with prostate cancer. So I'd never had any personal experience, but as a medical student, as a third-year medical student, for some reason this kind of care just sought me. And by just serendipity or what have you, God's will, He led me in this direction. I took extra electives and extra experiences with teaching doctors who just happened to also be involved in hospice. So had the privilege of working with Dr. Underwood up in Newark and Dr. Tim Moore at Grant Medical Center, and just it always kind of channeled toward this end-of-life experience. And then when I got down here, I just had the blessing to drive past the office one day when it was down in the Kroger parking lot, walked in and met Denise Bauer, and she just welcomed me into the team. So it was it's meant to be. Was
that helpful for you to start as a volunteer?
It was, because there wasn't a whole lot of responsibility. You know, I could come and go and be part of the team as I needed to be or as they needed me to be, but it developed a relationship because they came to rely on me and call on me, and then eventually, when one of our other medical directors at that time was getting ready to retire, Denise came to me and offered me a position that was an actual associate medical director position at the time, part-time job. And then it just kind of grew from there.
Yeah, here you are.
Love being here.
A lot of years later. What brought you to hospice and to Fairhope?
Also the same, I think, hospice called. It's a very gentle type of medicine where we do get to really interact with our families so extensively. I volunteered. I had a luncheon once and became with Fairhope Doctor, and then volunteered, and very quickly became a part of it. We were growing rapidly at that time, and so I got to be a part of that and had great mentors with Dr. Roach, with Dr. Varney, with Dr. Voyn, and it's become the most wonderful type of medicine that I could be involved in.
I love that you talk about Dr. Roach and Dr. Voyn. Dr. Roach obviously was here with me, with Fairhope, 30 years ago when I started, and he really was along with him and Dr. Snyder, he really was a mentor and just such a calming presence. And it's nice because I get the same from you two, because you two are always teaching, always endlessly teaching. And I love watching that. Like, we just finished our team meeting, and it's a long morning, but our staff are there and they want to learn about what's the best method to keep our families and our patients comfortable. And I love that you guys are always teaching and helping them to grow, not only just with the medical side of it, but just the other things that we look at, the social aspects to it. So that's something I think really unique that both of you bring to Fairhope, and I'm always thankful. I love listening to you guys when you're teaching.
I think the opportunity just kind of always leads in that direction, because like Dr. Singer said, this is an opportunity that we get to spend time with not only the patients but their families. So the one-on-one teaching, but then like you mentioned in our team setting this morning, we love the opportunity, and it seems like both of us are sometimes fighting over the opportunity to which one of us gets to talk about this one. And we do a lot of back and forth and bantering sometimes, but it's usually to the edification of our staff. And I think we learn from each other. I know I certainly learned from Barbara a lot. I think there's just a wealth of knowledge there. And sometimes we're talking about a topic, and Dr. Singer will start talking about something, and I just wondered, did I ever know that? Have I forgot that? Or did I just never learn that? So I think it's just a great opportunity that we all bring something different to the table. Dr. Singer being the Eastern medicine and the holistic approach, and me being the Western medicine and the typical MD-DO comparison sometimes of old. And then we've got Dr. Andrew Dag-Murray, who brings that whole infectious disease side of things. So it really is a wonderful marriage.
Yeah, I talk about this, and we did a show with Dr. Snyder's family a few weeks ago, and I talked about, if you remember, even just a year ago when he would come to team meetings, or a year and a half ago, and he would stop and he'd say, okay, now I'm going to tell you kids this, and he would talk about something that he learned or how he used to do it. And I thought, it's just, that's really what this is all about, is teaching the next generation the importance of what they're doing, what hospice is, and I just love that about our group.
I've often said that I think medicine should be an apprenticeship. I don't think necessarily the whole approach of school, college, residency, go out and be a doctor really prepares us sometimes. I think attaching yourself to someone who does what you want to do, and the whole mentoring, and we do a lot of that precepting here. We do some teaching, we have students come, and we do a lot of one-on-one experiences, which I really cherish. But I think that is just the way medicine should be taught. You need to learn from someone, seeing them do it. It's not something you can learn out of a textbook for the most part.
I imagine not.
And that's what our big hospice team is. I learned from you, we learned from the social workers, we learn from our nurses. There's just this power in putting all of that behind a patient's care, and every patient's name and case is mentioned at those teams. We are very thorough, and our patients benefit. Their families benefit from it.
Well, I think that's just the bottom line of what the hospice mission is. It's just a holistic, because you know as well as I know, and I'm a social worker, is that there are so many pieces to walking through that journey at end of life. It is about being comfortable physically, but emotionally, and having your needs met. You need to have food, you need to have shelter. So I just love the fact that it's just so holistic, and what we do here, I think, is pretty incredible. So. All right, I'm going to stop for a second and give us our phone number. We always get talking and forget to do that. So if you have any questions, any thoughts, need any information about Fairhope Hospice or our palliative program, please call 740-654-7077. I want to talk for just a quick second, because you two have both been here for a little while. What are the biggest changes that you've seen, not only in Fairhope, but also just in the hospice care?
I think that there's gradually getting to be an increased awareness of what hospice is bringing to people. I think we're often getting people later than we would like, because I think we bring a lot to the table, and that power is greater when we have more time with those patients. But I do think we're seeing more early referrals that really give us the power to do that. As the community gets more educated, I think there are a lot of obstacles in primary care or general care in having that conversation begin. So I think our practitioners are getting more comfortable with it, because it is hard to start a hospice conversation with a patient in an office. Are you going to offend them? Are you going to feel like you've let them down? There are all these things, but I think our practitioners out there are getting more knowledgeable, more willing to have those painful and challenging conversations.
Yeah, those conversations are uncomfortable, and that's one of the things that I enjoy being able to work with the young medical students and residents, young doctors in the community with, is just getting a comfortableness about having that conversation and making it fluid. It shouldn't be awkward, because it is just part of the life trajectory. I think a big part of the changes we're seeing is that heightened awareness of life being more of a continuum and not chapters. When I first started doing this, when I first started teaching students, I always drew this graph for them with life and this line of dividing how much care is preventive and curing early on, and how it transitions over time to the whole palliative, and at the very end is hospice. But when I first started, those were blocks, and you were either here, here, or here. And I started teaching the students that this was a line to follow, and it's a journey that we take together. So I think that awareness is helping to bring in the whole palliative approach, because before we didn't really talk about palliative care. It was kind of a new concept 20 years ago, and it's become very commonplace now, and I'm glad to see that change happening as well. We saw, when I first started here with this organization, we did this team meeting that we still do now, and there were 35 patients on Fairhope's hospice census at that time, and now we're in the 160s. That isn't all part of population growth. That's, like Dr. Singer mentioned, that's an awareness, that's getting our community aware and involved and thinking about this life continuum and trajectory, and also getting the young doctors trained to know when to have those conversations. One of the problems we see is the studies have shown that us in primary care are horrible at identifying those transitions because we're too close. We don't see it sometimes because we're seeing them so frequently. It's sort of like when you have a family member who comes to a family reunion and you see all these changes, but nobody in their immediate circle sees them.
Exactly.
So that's where the palliative care team comes in. Those nurse practitioners, they don't see these patients all the time, but when they see them, they're able to look objectively and look big picture. A lot of us primary care doctors, we're not on my watch kind of doctors. We don't want to accept what we consider to be failure. And someone dying is not failure. It's just part of life.
So one of the big changes has been the introduction of a really strong push for palliative services. So this is a patient who is still seeking more aggressive medical care, but also has a symptom burden. They have pain or sleep difficulty, anxiety, and palliative care can help people through that journey. And then if they do need hospice at some point, that transition is very smooth for them. So they're getting increasing care as they need increasing care, if they need increasing care. Palliative has been an amazing new service that we provide. We have a new palliative clinic, actually, here in Lancaster, the AIM Advanced Illness Management Clinic, and we're really proud of that added service to our patients who aren't quite ready for hospice and may not be ready for hospice so soon, but are truly struggling with advanced illnesses. So that's an exciting change for us.
Yeah, it really is. And I think what's interesting about palliative is, as you talk about early on, palliative was used for a lot of things. The word palliative was used for a lot of things. I mean, sometimes it intertwined between hospice care. So people, as we move forward with the real palliative definition, didn't always understand the difference. So that's been a whole, years of just trying to talk to people about, this is palliative care, this is for a chronic illness, and it's different than hospice care. The graph that you're talking about is interesting because as we started discussing the palliative program, we looked at what that graph looks like, and it does. It's more of just like a wave, and they overlap a little bit. At this trajectory of your life, as you decline a little, you can accept the palliative care, and then it just kind of rolls into that hospice piece of care. So there's a really gentle kind of handoff. So I think it's very exciting. I think people are really starting to understand the difference. The physicians are now understanding that the patients are not quite ready for hospice care, but that they know that they need help and support in kind of managing that chronic illness. So we're very excited about our new AIM clinic and excited about what we do every day here with hospice. So let me give that number again. If you have any questions, if you have a consult, if you'd just like information about Fairhope Hospice, please call 740-654-7077. You can follow us on Facebook, and also our website is fairhopehospice.org. So let's talk just a little bit more about really how to start that conversation as a patient, as a physician. Can we kind of talk about what that looks like? You touched a little earlier on the fact that sometimes it's hard for physicians to start that conversation. I think sometimes it's hard for caregivers to really say those words out loud. Definitely patients, but is there a way or something that we can do as hospice educators and as family members to help that move a little easier, I guess?
Well, one thing I would suggest is, if you're a patient in that position, you can also advocate for yourself. If you broach it with your care provider or family members, because it opens a giant well of resources to you that provide such comfort and care. So that would be my thing, is advocate also for yourself.
Right. The referral to hospice can really come from anyone. Obviously, you have to have a doctor's order or a nurse practitioner's order to proceed, but the first contact can come from anyone. It can come from the patient, it can come from a caregiver, a family member, or a provider. So having those conversations early on, I think one big thing to keep in mind is how important it is to talk to our families, to share with them what our wishes are so they know when it comes to end-of-life care how aggressive we want things to be. Not everyone really has to be on hospice. Everyone has the right to make their own choices in this world, and you can leave this world in any way you choose. Our purpose of being here is to help people who are leaving this world to do it comfortably. So if you want to do that and be aggressive to the very end, that's your right and your privilege. But that won't always be a comfortable, peaceful end. And that's why we're here, so we can help those transitions go more smoothly.
I think when we spent some time working at Fairfield Medical Center with the residents and doing some education, and you've done that with us before too, the one thing that we always want the residents to think about is asking their patients, what is most important to you? What are your goals? What are your wishes? That really that moves the discussion back to the patient. So if the patient can say, you know what, I just want to be comfortable, I just want to be at home, that kind of opens that door, I think, for the physician sometimes, which can take some of that pressure off of, the physician. So,
Right. And family members who feel like they need to tiptoe around the subject for fear of hurting the feelings or the emotions of the patient themselves,
Right.
or their doctor.
Right.
But on the primary care side, it really comes down, like we alluded to earlier, education. And that's the one thing that we really try to push for with trying to keep a relationship with our local hospital, which is a teaching hospital now, is opening the door to have those students and residents come over and spend time with us. I've said many times, I feel like hospice and palliative care should be a mandatory part of education.
I agree.
And other than a couple of lectures here and there, they don't really get this as mandatory education. We are an aging population. We're all going to die, and that end of life time frame is a very important part a lot of our healthcare resources are spent in the final months of life, sometimes final weeks, days, hours of life. And just kind of trying to look at it as being fiscally sound and sensible, knowing how to have these conversations, knowing when to start having these conversations. It can be also a big burden relief for the healthcare industry to utilize resources appropriately at the end of life. And that's where that education piece comes in.
Right, ample resources that don't improve quality of life.
Exactly.
So one of the lovely luxuries we have here is that we're a not-for-profit. And we can give so much more to our patients because we have this structure that is very purpose-driven, very mission-driven, and it allows us to be something really, I think, extraordinary in this community.
Very patient-centric.
Absolutely. Let's stay and talk a little bit more about that. You've been watching Fairhope Hospice today. Stay tuned and join us for the next segment. What makes Fairhope what it is our staff. It's always a question that we ask, why do you want to be here with us? And what they most always say is, you've touched my life this way. You know, you took care of this person, or I've seen what you've done and I want to do that. And so the staff that have been here know what it takes. They've been on the other side. They see what it takes to make someone comfortable, to make the family comfortable, and really what kind of support they need. And so I think that's what really makes Fairhope what it is.
If you've been thinking about getting a home loan, now is the time. Hi, this is Carrie James from Fairfield Federal. Our experienced lenders are here to help you make your vision a reality. For more than 125 years, we've been helping our community achieve homeownership. Fairfield Federal has convenient online application for your home loan, home equity loan, and home equity line of credit needs. Visit fairfieldfederal.com to get started. Fairfield Federal for checking, savings, and home loans. Data charges may apply, subject to credit approval. Member FDIC, Equal Housing Lender, NMLS number 402612.
At Fairfield DD, there are a lot of things to be excited about in 2025. We've launched a new website that has a ton of great information for the community. We also have implemented a brand new strategic plan where we lay out steps that we'll take in the next few years to move our mission forward. As always, community partnerships and collaboration help us succeed, as together we move as one. March is Developmental Disabilities Awareness Month. Fairfield DD is excited to participate in a wide range of events that raise awareness and build a community that values every person. Find out more at fairfielddd.com.
The Frankie Smith Funeral Home and Crematory in Lancaster and the Johnson Smith Funeral Home in Baltimore have a long and wonderful history of serving our community. Feel free to give us a call at 740-653-0652. Stop in and see us at either of our two locations, 405 North Columbus Street in Lancaster and 207 South Main Street in Baltimore. Respect for tradition, regard for change.
Managing your health can feel scary, but you are not alone. At Fairfield Medical Center, our network of healthcare professionals and compassionate caregivers are focused on one thing: supporting you. From primary care to specialty procedures and rehabilitation, we offer the resources you need to lead the life you love. Whatever you're searching for, you can find it at Fairfield Medical Center.
It is so important for families to feel comfortable and safe when they call, because oftentimes that first phone call, even picking up the phone physically and just dialing that number, is very hard. You're asking for something that is a very difficult and private decision, and so we want everyone to feel comfortable and safe that you pick up that phone, you make that phone call, and let us just guide you and lead you where you want. And then you can make an informed decision about what's best for you and your family. Welcome back to Fairhope Hospice Today. I'm Kristin Glazier, President and CEO at Fairhope Hospice and Palliative Care, and we've really had a great segment today with two of our physicians. We've talked a lot about just hospice care philosophy, and we started to talk just a little bit about nonprofit. Fairhope Hospice is a non-for-profit a hospice. And so there are some differences between for-profit, not-for-profit, and I think, Dr. Singer, you touched on a little bit of those. I think the biggest thing to remember is that, you know, for us at Fairhope, our goal is always to fulfill our mission. Our mission is to provide emotional, spiritual support, comfort to those facing the end of life and the end of their journey. And we truly believe, and I was taught that from my predecessor, that it's people over profits. You know, oftentimes the staff will come to me and they'll say, we really need this for a patient, but it costs this much, or this is what, you know, what we're looking at. And I'll say to them, is this what the patient needs? They say yes, and we do it. To the best of our ability, we always want our patients to have what they need. You know, we're able to utilize our community. Our community supports us endlessly. We can apply for grants as a nonprofit. We receive a lot of donations. Our community and families that we care for are so generous, and those donations come back to us. They go right back into taking care of our patients, because we don't ever want our patients, first of all, they'll never be turned away for their inability to pay. And you know, we want them to have what they need. We can focus on that. We focus on, and we've shown that we provide, you know, 10% to 35% more social work visits, nursing visits. There's not a question. If a patient's had a visit every day and they need another one, we're going to give them another visit. So, you know, just some thoughts about really what it means to be a nonprofit and how proud we are to be that here in Lancaster.
Mm-hmm. You know, my thought on it, and like I was talking before our segment here, is I don't really know a whole lot about the differences between these, but what I do experience here with Fairhope Hospice and us being a not-for-profit is that it's so patient-centric that we're able to focus on the patient and what the patient and the family need. You know, when you talk about those donations that come in, just look at where we are. This building is because of donations, and it's named the Pickering House because of the Pickering family who made huge donations to make this happen.
Absolutely.
And then our center down over the hill, the Anita M. Turner Center. She was one of my patients many years ago, and she was served by our hospice, and she just didn't really have anything to do with her wealth at the end of life, and we found out only after she had passed that she had directed a very large sum of money to be donated for help with those dealing with mental health issues and such. So it's just wonderful to have people think of us at that time and after someone passes to help us continue on this mission.
Yeah, and you know, as a nonprofit, we have to be very fiscally responsible. I mean, obviously, and it's important, and it's kind of a fine line. You have to make sure that you're doing everything that we need to do to keep our patients healthy and, you know, taken care of and given what they need. We have to take good care of our employees because what they do is hard, and we want them to feel good about the things that they do every day, but we also have to make sure that we're doing the other things, you know, following all the regulatory things that Medicare give us and taking care of the bills. So there's really a fine line, but I don't feel like that has ever stopped us from providing the good, solid care that we do with our patients. So, you know, I think we should all be really proud of that.
Right. Yeah. And the job of being sure that we're going to be here 10 years from now and 20 years from now while meeting these needs is no small task, and you deserve a lot of credit for what you've done to grow this organization to where it is.
Thank you. It's my pleasure. It's my honor to be here every day. I'm glad to be here with you today. Thank you for taking some time out of your week and
my pleasure.
Just sharing with our viewers what the importance of Fairhope Hospice is. So if you have any questions, we really would like for you to call 740-654-7077. Follow us on Facebook. Go to our website, fairhopehospice.org. Give us a call here anytime. We're glad to answer questions, get you in the right direction. You're always going to get somebody who answers the phone and will direct you to the right team member. Thanks for watching our segments today, and you've been watching us here at the Pickering House on Fairhope Hospice Today.
Interface Video presents Fairhope Hospice Today. Brought to you by Fairhope Hospice and Palliative Care, Fairfield Federal Savings and Loan, Fairfield Medical Center, the Fairfield County Board of Developmental Disabilities, Dagger Law, and the Frank E. Smith Funeral Home.